Healthcare. Here to tell us more is Anurang Revri, the Vice President and Chief Enterprise Architect at Stanford Healthcare. Welcome, Anurang.
Thank you. Thanks for having me here.
Thanks
It's
for
lovely
being
to be
here.
Welcome.
We are really excited to have you here. So, Anurang, Stanford Medicine is a premier medical school and healthcare provider right here in the Bay Area. And we know that the healthcare industry has seen huge changes over the past few years, both for patients and providers. So, what is the biggest transformation MuleSoft has helped with in terms of patient care for you?
Yeah, so as you know, Stanford Medicine is a three-part mission. We have education, research, as well as clinical care, which is mostly what the hospital is known for. And a lot of this cannot be done by ourselves. So one of the key things we are using MuleSoft is to achieve our interoperability goals. So, an example of that would be, we use MuleSoft to automate end-to-end of matching the bone marrow transplant donors to the ones who are going to receive them. And it was all a manual process, and people had to re-enter data and all that stuff, and we automated that end to end. And so rather than it taking weeks or sometimes months or losing some of people's records, people can get immediate care and transplants if they're available, actually. So it's really the interoperability is key for us.
That is phenomenal. From months to days, that is tremendous and life-changing work for both patients and the providers as well. And I'm curious what is going on at Stanford. What excited you from the keynote today?
Yeah, a couple of things that struck me. One of them was around trust, the theme around trust. And the second one was around, what William Sonoma was mentioning around, there's nothing artificial about artificial intelligence, right? So those things are important when you go to your doctor, right? You want to trust your doctor, and you want to, make sure that you get personal service, right? And where we're using MuleSoft to help us with that, it made me think was to actually, one is to making accurate data in a timely way available through APIs to the different applications so they can provide, good service to you. And then the other is sort of, we are creating more authoritative views of, patients, providers, and our employees to make them available for, providing service again, actually. So I think those two things, from a trust and service point of view, rather than being artificial, are going to be, in my mind, those stuck in.
Love it.
Yeah, Anurang, what's the next big technology initiative involving Salesforce and MuleSoft with Stanford Health?
Yeah, so there are two things we are doing. One is I'm also leading the data science group. And so when we have to run these models at the point of care, whether it's looking at, having a doctor focus on a certain part of a, X-ray or an MRI or other decision making, so we need the actual, patient data available real time, at the time of executing the model. So the data science, it's going to be key for us to actually make data science successful.
And so meaningful to patients.
Yes, it is actually, yeah. And it assists, the providers at the right time to have the right information. And the second is we are actually transforming our entire supply chain. And as you know, during COVID, we learned there are so many gaps in supply chain. So either people store up stuff and they end up getting wasted, which is not good for the environment either, putting aside money. And, so what we're doing is we're trying to connect the demand, which is, looking at procedures that are being scheduled, operations, all that stuff, and then trying to match that with the supply so we can get just-in-time supply of, medicines and, orthopedics or whatever you need for that particular procedure. So that will avoid waste. It'll make sure we don't have shortfalls. So I think, to me, these are exciting things that are happening in healthcare and at Stanford.
Well, all of us here at Salesforce and MuleSoft love working with an organization that shares our values. And I think having lived through the last few years, all of us can appreciate firsthand the changes that these are going to make to our daily lives. So thank you.
You're welcome. Nice to be here.
Yeah, we loved hearing about everything you're doing at Stanford Healthcare, and we're proud to be a part of that.